A crowded Delhi market prime for the spread of infection.
Only 100 rupees, only 100.
The vendors mostly afraid of the virus but needing to support their families. Sarojini says if the disease doesn't kill her, hunger certainly will. She's hoping a vaccine comes fast with so many dying. Steps away, Anil Kumar is trying to sell as many masks as possible. He's adamant any vaccine made in India should stay in India. And there are more than 50 million doses at the ready in the country, pallets of them kept in a cold storage freezer at the Serum Institute. Even before the pandemic hit, it was the world's largest vaccine maker. Those others now on the back burner. Our tour of the facility shows fermenting and purifying the COVID vaccine developed by the Oxford AstraZeneca team takes priority. That specific vaccine was a gamble the family-run company made early to mass produce long before approval to save time and lives with this.
There was so much uncertainty. We didn't know which vaccines would be safe.
Absolutely no regrets from the billionaire CEO.
Feeling quite good and relaxed now. At this stage, it's been a very stressful time doing all this, and now we're on a sort of autopilot mode where we're just waiting for the results to come in.
India already supplied more than half of the world's vaccines before the pandemic.
It gives you the protection.
Where the country was far behind was on PPE. But it didn't take long for many, like this garment factory owner, to pivot. From zero know-how in making all this to it making up nearly a quarter of the company's revenue.
In our case, it was purely to stay alive. Had I not done it, we would probably have to shut my business.
Producing gowns and vaccines, and so quickly. India is also planning on sharing its wealth with poorer countries, making sure they also get doses. Because of its vaccine capacity, India has that luxury. But there is a monumental task ahead at home, administering doses to 1.3 billion Indians in a country so vast.
I'm very hopeful that by the end of next year, it should be something that will be easy for everyone to get.
We've seen this happen.
Hopes aside, experts see the challenge India is facing to dramatically ramp up its current vaccine program as daunting.
But we want to deliver 500 million doses in a year. It would take about 27 years to do that at present staff capacity.
A massive undertaking that many here are counting on, with the number of infections closing in on the grim milestone of 10 million. Salima Shivji, CBC News, Delhi.